First off, I'd like to say that gangrene is disgusting. The pictures in this presentation are also going to be disgusting, so just be forewarned. Gangrene is tissue necrosis due to the lack of blood flow that is caused by an illness, injury, or an infection. There are two main types of gangrene. There's dry gangrene, which is more common in people with vascular diseases, diabetes, or autoimmune diseases. So gangrene affects extremities, so your legs, your fingers, your toes, your hands, and this is because it is the most distal portion of your body. So when you have a lack of blood flow from something blocking it, the first thing that's going to be affected are your fingers. Wet gangrene is pretty much the same as dry gangrene, but it involves an infection, and both gangrenes are normally caused by burns, traumas from a body being crushed or squeezed. Infections with wet gangrene can spread around the body if left untreated. Dry gangrene starts with the discoloration, so it goes from blue to black, and then your skin starts to shrivel up a little bit, and then it eventually falls off. Also, with poor circulation, your fingers get cold and numb. You also feel pain. With wet gangrene, you have a lot of infection-like symptoms, so swelling, pain, fever, and the discoloration is different from dry gangrene, where instead of it being blue to black, it's more red, brown, blue, greenish black, purple. There are blisters or sores with gross-smelling pus that's exuding from them. Wet gangrene will cause the skin to crackle when pressing on it, and wet gangrene will develop a thin, shiny, or hairless skin, and then this obvious line between your healthy and damaged skin. So there are a lot of risk factors that go into people who develop gangrene. These are more predisposed people, so people who have diabetes or vascular diseases such as narrowed arteries or atherosclerosis, a peripheral artery disease, or Raynaud's phenomenon, which is when blood vessels in your skin begin to narrow. Smoking really increases your risk for developing gangrene when you suffer trauma or serious injury, which is another risk factor for gangrene. Serious frostbite can cause gangrene, so can a weakened immune system and obesity. Surgery is one of the most common treatments for gangrene, so it's called debridement, where the dead skin is removed, and then if being removed doesn't reduce the spread of the infection, the extremity may be amputated. This is maggot therapy. A surgical lab develops these maggots in a very sterile environment, and then these sterile maggots are put on the dead tissue and they begin to just eat it. And they also help fighting infection because they release chemicals that can kill the bacteria. Managing your health conditions, this is mainly for predisposed individuals. You just need to check your extremities for signs of injuries or slow wound healing or other skin problems. Watch your wounds. If you smoke and you don't want gangrene, just stop smoking. So that's it. Thank you for watching.